Good morning everyone. I am Dr. Sandeep Janardhan Tandil. I am a general and laparoscopic surgeon. As we have discussed in previous episode about the nail, this episode is continuation of the previous video about the nail. So we are discussing in this episode various diseases related to our nail. Next thing we are going to discuss is about nail plate. Is the nail plate, the hard part, and what importance it is, and how it helps the doctors in diagnosing the different conditions. So the nail color, the shape of the nail, how it is growing, then all these things gives lots of information. That's why I said initially they are the windows of the underlying conditions in our body. So first thing I will like to talk is about onycholysis. So what is onycholysis? Onycholysis, what happens is the nail, the distal part, this later part of your nail gets separated from the nail bed. You will see it is loose from that area, but initial part is fixed. The nail will be firm, it will be shape will be normal of that part, but distal part will be loose. So what are the conditions, in what conditions it happens? Trauma, the injury to the distal part of the nail can cause it. Then certain thyroid conditions, thyroid diseases like hyperthyroidism, sometimes it is associated with that. Then plumber nails it is called. Anemia, when you have hemoglobin is less, that can happen. Then there are certain other conditions which are like leprosy, psoriasis, then pemphigus. Like there are so many other conditions which can cause this condition. So when you see something like that, it's better you meet a doctor and get the things diagnosed. Next important thing is the clubbing. What is clubbing of the nail? Clubbing means the nail transversely it will become curved, and even vertically it will become curved. Like sometimes it becomes like a parrot big appearance of this. The important things to find in this, the angle. You see there is an angle between the skin and the nail plate. That is around 160 degree. When this angle becomes more than 180 degrees, that means you are getting a clubbing. Then there is something called as a Shamrock's window. Shamrock's window means when you touch both the fingers like that, there will be a small gap in between. That is called as a Shamrock's window. If that window is gone, that means you are getting a clubbing. So there are the different tests which doctor will do to find out the clubbing, the stage of the clubbing. Now clubbing is related to multiple diseases. Like if you have a lung disease, underlying lung disease, heart disease, then you have thyroid related conditions, then inflammation of the intestines, inflammatory bowel disease, and even liver diseases. There are different conditions where this angle is obliterated and clubbing happens. So if you see any of these changes in your nail, it's better you meet a doctor and get it diagnosed. Now next important condition is the koilonychia. What is koilonychia? If you see the nail, the nail plate will become like a spoon. Like if you put a drop of water, normally the nail won't hold any drop of water on that, it will fall down. But if you have a koilonychia, if you put a drop of water, you can hold a drop of water on that. That is called as a koilonychia. Now in which conditions it can happen? It can happen because of injury, it can happen because of iron deficiency anemia, that is less iron in your body, hematochromosis condition, coronary artery disease. It can happen in hypothyroidism, condition where the thyroid is functioning low, hypothyroidism, it can happen in that. So it can also happen in people where they are exposed to the petroleum based products. Next condition is onychomatosis. All different names. What happens in this condition is the initial part of the nail, this part of the nail start getting separated, it gets injured or it becomes loose from that area. This happens again in cases of the injury, trauma. It can happen in malnutrition, like the nutrition, you don't have adequate nutrition, that can also cause it. Then a Kawasaki disease, it's an inflammatory condition of the blood vessels. Then hand, foot, mouth disease, it can happen. And if you are sensitive to certain drugs, this condition can happen. Next important thing is a bew lines. Now what is a bew lines? Some people, or sometimes you see there is a depression in the nail, transversely, like sideways there is a depression in the nail. The nail goes suddenly in and then it comes up. Why? Because temporarily there is the nail growth is stopped. It's stop. That's why what happens is in between it is not growing and it becomes depression. Again it start growing. So the distal part you will have a proper nail. In between there will be a small gap, and gap means it will be flat, depressed, and the nail is going up. That happens in cases of uncontrolled diabetes. It can happen in malnutrition, that is you are not well nourished, and in case of sometimes high grade fever, that can happen. Next condition is called as a Muherke nails. What is Muherke nails? In Muherke nails you will see it transverse. Transverse means like this, horizontal white lines. You have a natural normal whitish area, half moon shaped area. That is the normal thing from where the nail grows. But just parallel to it, above you will find multiple whitish lines. That is called as a Muherke nails. Why it happens? Which conditions happens? Leads to the formation of the Muherke disease is if you have less protein in the body, which is called as a hypoalbuminemia. If your body is retaining too much of water, which is called as a nephrotic syndrome. In a people who are having kidney diseases, liver diseases, or malnutrition, sometimes post chemotherapy patients also can get this whitish transverse bands on them. This happens because of the abnormal blood supply to the fingernail. If there is no inadequate or proper blood supply is not there, then this type of the nail can happen. Next condition is a Lindsay nail. What is Lindsay nail? In that the distal part of the nail will be little brownish or pinkish, but proximal, the initial part will be whitish in color. That whitish color is because now there is something called as a melanin under our skin that gives a color to our body. That some people are white, some people have become tan after if you get exposed to the sun for a long time. That is because your melanin pigments get activated and it gives the color change. So in Lindsay nail what happens is the melanin formation initial part is less, it becomes whitish color in that area, but distally it remains pinkish color or sometimes brown in color. This also happens in people who have kidney related conditions like dialysis patients or renal transplant, kidney transplant patients. Next condition is terry nails. What is terry nails? Terry nails is all the fingernails will be white except for the distal pinkish band. Like distal means the last part of the nail will be having a small thin pink band, rest of the nail will be white. This also happens because of the improper blood supply to the nail, and conditions associated are again kidney disease, heart diseases, and sometimes liver disease also related to this condition. Next condition is red lunula. Red lunula means the initial part of the nail, it will be the half moon shaped whitish area which you see, it becomes reddish in color or sometimes even bluish in color. So what are the conditions in which this happens is people who have alopecia areata. Alopecia areata means the patchy hair loss. Those people you can see such type of the reddish color. Certain heart conditions, heart failure patients, or cirrhosis, liver diseases, people who are on steroids like prednisone can produce this type of the condition. Also important is the carbon monoxide poisoning. In that condition also the lunula can become reddish in color. Wilson's disease. Next condition I will say is a melanonychia. What is melanonychia? Some people on the nail you will find vertical blackish lines or bands, you can see single or like 2-3, but they will be straight and like blackish coming from the lower part and going up. So now again this happens because of the melanin. Now the germinal matrix, the part from where the nail grows, this melanin in one particular part, it gets activated. It becomes so much that one particular line will be completely blackish in color. Will not be complete dark black, it will be slightly blackish in color. Now why it is important is, if it is light, if it is straight without irregularities, then it is okay. But if it is becoming more darker and darker, it is becoming irregular. That like a vertical line, it is becoming irregular. It is spreading laterally. It's could be melanoma, and you need to definitely evaluate such condition by showing it to doctor as early as possible. There is something called splinter hemorrhage also. Splinter hemorrhage means sometimes some blood just spreads up from below up, which also can give a little blackish color line in that area. So this condition should be ruled out from melanonychia. This Splinter hemorrhage can happen because of the trauma. It can happen because of endocarditis. Endocarditis is the heart condition when infection of the inner part of the heart. Also in cases of liver disease like cirrhosis or vasculitis. Vasculitis is the inflammation of the blood vessels. Next condition is retronychia. Now what do you mean by retronychia? Retro means backwards. So in some people, because of ill-fitting shoes or continuous pressure on the foot nails, what happens is the nail start growing downwards and backwards, and that will produce the pain, swelling in that area, difficult to walk in such situation, redness, swelling, all those things will happen in retronychia. If it happens, then you need to see doctor. Also you need to modify your lifestyle, like avoiding the tight fitting or ill-fitting shoes, and avoiding the injury to the foot nails. The next condition I would like to talk is about brittle nail syndrome. Now what is a brittle nail? There are two types in it, onychorexis and onychoschiasia. Now onychorexis means the vertically you will find the ridges or lines, multiple lines you will be seeing. Like you see like a nail is formed by small pieces in like different parts of the nail, like joined together, and it is forming. Usually our nail is flat, one continuous nail plate, but in onychorexis it will be like small nail plates forming, and it is forming a combined nail plate. What happens in onychoschiasia is the distal part of the nail just comes out, like your nail is so brittle and weak that the outer part, the tip of the nail, suddenly transversely you will find it is breaking up and coming out. So this brittle nails, why it happens is when the nail is forming from the keratinocytes, the cells which help in forming the nails, these cells are attached to each other, like they are stick to each other with adhesives, that is natural adhesive, which keeps it stick together, and it is so tightly stick to each other that you won't find any gap. But what happens in brittle nail, there will be the gaps in between. This adhesions is not proper, like you are putting a glue to put two things together. This natural glue is not adequate, and which causes separation of these plates, and then you can find the ridges in between. And transversely, same thing, the nail gets weaker and it breaks. That is the why the nail becomes brittle. Various causes for the brittle nail syndrome. If you ask me which male or female it happens, more happens in the females. The occupations which lead to the brittle nails, like people who requires frequently washing the hands, like getting the hands wet frequently, people who manicure their finger nails very frequently, excessive use of the nail paint remover, those who smoke can get this condition. Malnutrition also can cause this. There are various underlying conditions of our body, like thyroid diseases, liver conditions, or related conditions that can also produce the brittle nails. So when you get this condition, you should definitely get it evaluated by seeing a doctor, what is underlying cause. So these are the various conditions of the nail which guide you and guide the doctor actually to diagnose underlying conditions. So if you get any of this condition, any change, color change, or any difference which you find on the nail, you should not ignore it. You should get it evaluated from a doctor to find out if anything abnormality is happening inside our body. And there are more conditions which are related to the nail, like nail pad injury. I will discuss about it in a next video about nail injury or nail pad injury, what are the different treatments available for it. Hope you understood and enjoyed this video, and I will further come up with the nail pad injury in the next videos. Thank you for watching me and listening to me. Thank you very much.